information about pets?
Sure do. They're nice.
Sorry, I should have been a little more clear. Do you have any information about pets and with people that are struggling with cancer?
Absolutely. So when it comes to pets and anybody going through cancer, chemotherapy basically is the big one, and or transplant. Go ahead and take it that way. You're going to want to make sure that you stick to the pets that you already have. Okay? You know why?
What I think is that when you're more exposed to pets, your immune system gets used to the bacteria and presence of the pet that you have.
Yeah, that's exactly right. So if you already have a pet and you were just recently diagnosed, of course that pet most likely can't meet you in the hospital. Won't be allowed because it's your pet and you have built-in immunity up to most of the bacteria that the pet carries around. What that does mean, though, is you could possibly be let loose or released from the hospital to go home and have a good time. And that was a silly joke there, but it's actually how it feels sometimes. Cancer patients a lot of times feel as if they're trapped for a little while. So it's like, oh, I've been set free. You get to go home and see your dog, your cat, or your guinea pig, if you have hamsters. But because they're rodents, there is a misconception that rodents are dirty creatures. And the actual creature themselves are not very dirty unless we let them get dirty, right?
Yeah.
So, what do you think we should do before they come home to any pet that we have?
Wash your hands and clean them.
Yes. So with smaller rodents, it's probably a little, not recommended, I should say, not very smart to wash them with water. But what we can do is take their cage, we can break it down, we can move from a cedar or a pine bedding that creates a lot of dust over to a possible, maybe some towels. There's also some other types of bedding that are made from material like recycled cardboard and paper. I know that can cause some dust, but not as much as cedar beddings and wood-generated beddings. Once you've done that and the cage is clean, the animal, like I said, they're extraordinarily clean, will clean themselves and rearrange their cage and just in time for your family member to return home to relax, and that family member should be able to hold that creature and enjoy him or her in their time as long as they have previously had that pet. This includes dogs and cats. Now, be careful washing a cat. They're not too happy about water. Yeah. You may have one that is. It's unusual, but they are out there. A guinea pig can also be washed in a shallow bit of water.
Yeah, try not to make it so deep because they don't really like it. They're not very aquatic creatures. So what we recommend is putting them in a sink or, a bathtub. And make it about an inch of water, enough for you to scoop up some water and pour it onto your pet. And just scrub them with a little bit of non-tearing shampoo so it doesn't hurt them in their eyes.
You can also find organic shampoos and stuff like that now too at Whole Foods and other vitamin shops, right? And don't use a lot. You don't need froth and foam everywhere. We just want to get the critter clean and prepared for visitor and reunite, right? Yeah. That's the best part. Also, we'd like to recommend some pets after transplant or after chemotherapy. Mind you, this is when you've been cleared by a doctor to get a pet. And that's because, like you mentioned earlier, right? The new pet has bacteria that you and I haven't been introduced to because we have fresh and healthy immune systems. We can easily adapt. We might get an itchy eye or a little allergy or something like that. But for our family members that have had to deal with chemotherapy or going through a cancer process or going through transplant process, it's not recommended at all until the doctor gives an okay. But as far as recommended pets go, interestingly enough, dogs. You can actually train a dog to sniff out cancer. And it's very real. What we'll do in the comments section of this video is share a couple of websites where you can actually attempt to train the dog yourself. I kind of skimmed over this because for some reason it doesn't seem realistic. We're going to get some cancer for them to previously smell. Right? It just doesn't make sense.
We'll be putting sources in the description to inform you a little bit more because we're only going to give a little information and we're not going to talk a lot on that.
Yes, because most of these websites that actually have the ability to train these pets to be able to detect a cancer or a cancerous scent, however they do that, have trained professionals that can do it. We don't recommend any other training except for standard basic training, which would be sit, stay, come, roll over, and that's about it, right? And those are good skills to get started with, but a family member should do that for your ailing family member while they're in the hospital so the dog is ready when they're cleared to have the pet. And there is a slight caveat to the animal being able to detect cancer.
What is that?
Well, unfortunately, unless of course you have a large amount of money or created some sort of a GoFundMe or there's a charity that will agree to pay out, here's the extraordinary caveat. The dog can actually smell the detection or smell and detect cancer before the tests we use in the hospital can. Yeah,
I never knew that.
Yeah, it's pretty amazing. And the caveat to that is you'd like to get immediate treatment as soon as possible so you can get on to that and stop it as fast as possible so you minimize risk and prolong life, right? And you would have to cover whatever medical bills you accumulated until a test came up positive. Off the top of my head right now, a CA 125 test for ovarian cancer. I know it's for women, but that can come up, or an AML leukemic, any kind of a leukemia test. I'm not sure of the technical terms for those. You would have to repeatedly do those tests until finally you got a positive that matched the dog's alert, which can become costly. But if the funds are there, and again, if you're working with a foundation that's willing to help, you're doing well.
Now, we don't have a lot of information on this, that's why we're including it in the description.
Correct.
But we are glad that we can help with, like problems.
When it comes to like trying to assert a different kind of pet, right? So we know there's seizure dogs. We've now learned that there's cancer detecting dogs. So what we would like for you guys to do, perhaps, right, it's a good idea, have folks add some comments and suggestions as to what they may have found in their own research. Because I found this. I remember Carla really wanted a pug. We had a pug. He escaped and went to go live with someone else. I guess we didn't feed him enough. Something was wrong. But that's okay. That's how it works. And we wanted to get a new pug. And I got in touch with the dog trainer that actually was professionally trained to be able to detect for cancer at the time, back in 2019, I want to say, late 2019, when Carla was actually in remission. And she had gone into zone 4, which is after transplant, and it's like pretty much like you're good, you're in remission. We could have bought a pet. You have to take into consideration the cost of the animal. You're going to want to call the professional and find out what type of dog they recommend. We just wanted the pug and thought it would work because we never got through the entire process before relapse, unfortunately. But most of the training costs anywhere between $5,000 and $7,000, and I completely think it's worth it if it's successful and it's able to help your family member out.
Yeah.
Okay.
We would like to, before ending this video, we would like to thank you for everyone watching and all the likes and people that just enjoy our videos and can get help from this. And if you want to include some of your own information in the comment section, we would be glad, and we would possibly pin you in the top of the comment section.
And we could do, if someone makes a really good suggestion, we do some research of our own to kind of like nail it down correctly. We could do a video on it for them.
Yeah, we can.
Okay, and we'll mention your name.
Yeah, we'll give you a shout out.
Yep. Well, that's all we have today. Gio says goodbye. He's ready to, probably wants to go back at his pineapple. There we go. So that's that. And thank you, son, for the question. That was awesome.
Yeah, well,
Boom.
have a good day, everyone.
Another good one.